Hi everybody. Today our focus is going to be on the ability of the heart to create electrical impulses that leads to muscle contraction. So one of the first thing I want to talk about to start with is a review of a concept that was described at the end of the previous PowerPoint, and that was the focus of the main difference between a skeletal muscle and cardiac muscle. So one of the actions that take place when we're discussing the ability of the skeletal muscle to contract is we have something called excitation, contraction, coupling. So this excitation and contraction coupling the excitation part originates from the nervous system, which leads to, again, a skeletal muscle contraction. And again, we're talking about a skeletal muscle. However, if I want to create an excitation contraction coupling within my heart, for the excitation part, I'm not going to rely on the nervous system. Rather, I'm going to rely on a specific type of cells called pacemaker cells, which also are identified as non-contractile cells. And basically, these cells are going to lead to cardiac muscle contraction. So this is a significant difference, which means basically a person might not have a functional nervous system to some degree, but their heart still would be able to beat because your heart is beating independently from your nervous system. However, do keep in mind that I still need the input of the nervous system to increase or decrease the heartbeat. I just don't need the nervous system to initiate the heartbeat. So for the cells to be considered or be able to create electrical impulses or create something called action potential through a process called depolarization and repolarization, you need the cell to be excitable, which basically means they have to have the ability to create, produce, and also respond to electrical impulses. Now, it's kind of self-explanatory when we're thinking about nervous system, because nervous system is built upon electrical impulses. It is communicating through electrical impulses. But you also have the three categories of muscles that are also identified as excitable cells, because again, they have the ability to both produce and respond to electrical impulses. And that is the goal for us to understand it today as far as how the cardiac muscle, specifically how does your heart muscle accomplishes that. So if I want to create an excitable cell, what I need to create is first I need to establish an electrochemical gradient, which basically stores energy in the form of basically potential energy and allows the cell to become an excitable cell. So electrochemical gradient is basically thinking about your membrane and creating differences between inside the cell and outside the cell in a sense of electro implies charges, and the chemical implies basically your ion concentration. So I need to have variation between the charges inside the cell and outside the cell, as well as different in concentrations of the ions inside and outside the cell. And that differences enables the cell to possibly be excited if the proper stimulus is present. So let's take a look at some of the components that are essential for establishing electrochemical gradient. So as I mentioned, electrochemical gradient is the sum of all of the electrical and chemical forces that are acting across the cell membrane on either side again. Now, in a typical cell, that charge ranges from, and again, this is sometimes debatable, negative 60 millivolt and all the way down to negative 90, or sorry, I should say close to negative 90 millivolt. It never reaches negative 90, so around 85-ish. And the components that are basically contributing to creating this negative charge are associated with potassium and sodium. Those are your two most important ions. And the third component that I mentioned is A negative, which basically implies amino acids with a negatively charged inside the cell. So if I look at the cell itself, what a normal cell, an excitable cell has, basically it has an environment. Let's say it has typically around negative 70 millivolts. And this negative 70 millivolt is maintained with having high sodium concentration outside and low sodium concentration inside, and low potassium outside and high potassium inside the cell. These are essential ions that are help maintain the electrochemical balance within your cell, within your excitable cells. Now our goal is to understand how do we establish and maintain this electrochemical gradient. So we're going to start by talking about establishing these electrochemical gradient. So let's think about a cell, and this cell basically has equal amount of sodium inside the cell and outside the cell, what you start with, and equal amount of potassium inside and outside the cell. Now what you're going to do to establish the electrochemical gradient, to establish it, is we're going to implement a channel, and this channel is going to be a channel which we call sodium potassium ATPase, which all of you should remember. It is a type of channel that uses ATP to move sodium out and potassium into the cell. So the number of sodium potassium that moves is, it moves 3 sodium out and it moves 2 potassium into the cell. So as these proteins continue to work, you're gonna push more sodium out, and that leads to what? Having a higher sodium concentration outside because you're pushing more sodium out, and that also leads to having higher potassium inside the cell because you're pushing more potassium in every time this channel works. So if I ask you, how do you establish your electrochemical gradient? You're using sodium-potassium pump to actively push sodium out and potassium in. Now the next question that arises is, how do I maintain this electrochemical gradient? So this is, first of all, let me show you this slide. This is basically highlighting the establishment of the electrochemical gradient. Your sodium potassium ATPase, 3 sodium out, 2 potassium in through the use of ATP. And again, you're establishing a separation in your charge by having more sodium outside and less potassium inside the cell. Now, how do I maintain this electrochemical gradient? So for this, I'm going to rely on the channels that are identified as leakage channels. So leakage channels, if you guys remember this again from your lectures, leakage channels are identified as channels that are easily going to allow the ions to diffuse with their concentration gradient. So let's draw a cell, and we establish that inside the cell you have outside the cell you have high concentration of sodium, and inside the cell you have high concentration of potassium. So I'm going to start by inserting this channel, which I'm going to call it sodium leak. So if I have a sodium leakage channel, there is no energy, so sodium, which is high outside, is going to start to leak into the cell with its concentration gradient. So again, this channel are going to allow sodium to move in. Now I also will have another set of channel that I'm drawing at more frequently, a higher number, these are called potassium leakage. And think about this. If these are potassium leakage channel, what are they going to do? They're going to allow potassium to leave the cell, right? So potassium is going to leak out. So leakage channels allow sodium to come in and potassium to leak out. Now, if I think about this, notice that I'm saying more potassium is leaving the cell, right? So it means your cell is, what is it doing? It is losing more positive charge, and as a result, cell becomes what? Negative. Should say cell is negative inside, right? Because you're losing more potassium than sodium coming in. So basically, you're losing more positive charge and gaining positive charge. Now think about this. We're saying if diffusion happens, if diffusion takes place, diffusion eventually stops when you reach what? Equilibrium. So if I'm only relying on these two channels that I show, sodium is coming in and potassium leaking out, eventually what I'm going to reach is equilibrium. And you're going to reach the equilibrium of potassium faster because your potassium is leaking about 30 times faster than your sodium is coming in. So you're going to make the cell reach a very negative number. You reach equilibrium for the ions and you're done, right? Cell will not be able to allow to move any more ions, and basically it loses its ability to be excited. So how do you maintain the concentration of sodium and potassium that allows this leakage channel to continue working? How do I maintain the concentration of sodium high outside and potassium high inside to allow the leakage channel to effectively work? Now for that, again, we're going back to the type of channels that I described earlier, which are called what? Sodium, potassium, ATPase. What are these channels going to do? They're going to push sodium out 3 at a time, and they're going to put potassium back in, right? Which means now my potassium is basically continuously being regenerated inside the cell, which means it can leak out. And sodium is being continuously pushed out and then can leak back into the cell using the leakage channels. So what I'm describing as these 3 steps, the 2 leakage channels and the sodium potassium ATPase, are essential for what process? Maintaining, sorry, my thing is not writing, maintaining electrochemical gradient. So before, if we're thinking about establishing is done by sodium potassium ATPase, and maintaining that electrical impulse, electrical chemical gradient, is done by sodium leakage channel, potassium leakage channel, and sodium potassium ATPase. And again, remember that that potassium is moving out of the cell faster than sodium moving into the cell. Here's the numbers that I'm describing for you. If you take a look at the picture and the chart, right here we have the ions. So we have higher sodium concentration outside the cell, low inside, and the permeability is relatively low. Potassium, low outside the cell, high inside the cell, but your membrane is highly permeable to it. We don't discuss chloride because it's not an essential ion in the sense of the electrochemical gradients and excitations of your cardiac cells, so we don't discuss it. It's something that comes into play when we discuss nervous system and neuron. Now, when I have established my electrochemical gradient, this cell has the ability to be excited, but that instant, without any stimulus, they're going to be basically not doing anything. So I'm going to use the word resting membrane potential, or RMP, to describe the membrane potential that is basically maintained by, again, the three components that I mentioned: sodium potassium ATPase, your sodium leaking in, and your potassium leaking out. As I mentioned, resting membrane potential has a chance of reaching potassium equilibrium, which is close to negative 90, but it never reaches that, because as you're leaking potassium out, what are you doing at the same time? You're doing sodium and leaking the sodium into the cell, and that helps the potential to be maintained a little bit above negative 90. Now let's look at some of the vocabulary, and I'm going to end this PowerPoint by just getting to know this vocabulary, and we'll continue about non-contractile cells and how they get excited. So first word, we already discussed it: resting membrane potential. I'm going to repeat this again one more time. This is a potential of the cell when there is no stimulus. It is a negative number. Okay, and it's done by three components, and try to say it with me. It is your sodium potassium ATPase. It is your sodium leakage and your potassium leakage. Sodium is leaking where? Into the cell, and potassium leaking out. And potassium leaking out is faster or more efficient. Now, anytime you hear the word depolarization, this means making the inside of the cell more positive, which basically means, or less negative, which is happening by gaining positive charges. And the two charges that are going to be gained to cause depolarization is either sodium moving in, which you already should know, because sodium coming in means I'm gaining positive charge, so I'm gonna depolarize. And the other ion that I haven't talked, but you do need to know it, is calcium. Calcium also comes in because it's high outside the cell and low inside the cell, so it's gonna come in and begin make the inside of the cell more positive, or in another sense, less negative. Now, the opposite of depolarization is a process called repolarization, which means making the inside of the cell less positive by moving the charges, the positive charges, out of the cell. This is basically describing moving back to the resting potential. So in this sense, when I'm talking about repolarization, the most common ion that causes the repolarization process to happen is potassium moving out of the cell. Again, think about this. Potassium is positive, so if I'm losing potassium, that means I'm losing positive, so I become less positive, or another sense, moving toward my resting potential, which is a negative number. Now, threshold is a number of a specific number associated with your membrane potential that triggers a process known as action potential. Action potential itself. So what is action potential? Action potential is a propagated change in the membrane potential of excitable cell. In another sense, action potential is depolarization and repolarization. So think about this. if you're looking at your cell, and I'm just going to use my blank slide to show you something. If you have an environment, let's say this is negative 70, and let's say this represents positive 30 millivolt. I have resting, this is resting, right? Negative 70. If I start to go toward the positive, become more positive or less negative, this is a process called depolarization. And if I start to come back down toward the resting, that is repolarization. Now, this whole process of depolarization, repolarization, typically if it passed the threshold, so if this is, let's say this is my threshold right here. So if this is threshold, this increase, this part and coming back down, this would be describing my action potential. Anything past your threshold. So let's keep these words in mind as we start to look at the concept of electrical impulses within your cardiac muscle cell.